So a lot of people are on blood pressure medications. So the major question is, do I even need to be on it? Why am I on these medications, and how can I treat it naturally without being on medications? So if your blood pressure is between the 120s and 130s, you actually don't need to be on blood pressure medications. Lifestyle changes, this includes watching what you're eating, watching your salt content, reducing your salt content. Just don't add salt to anything. It's probably the biggest way that you can treat your blood pressure without being on medications. Next one is going to be exercising, but more important than exercising is exercising consistently. This is going to take anywhere from 6 to 12 weeks of consistent exercise. With exercise, weight loss, significant weight loss. Ideally, if you're obese, my biggest recommendation is 10% of your body weight. If you can lose that, you will significantly see your blood pressure come down. Another one that most people don't really factor in is stress and just how stressed you are. If you're under a lot of stress, not getting enough sleep, that's going to cause your blood pressure to be elevated significantly. So if you can watch what you're eating, watch how much processed foods you eat. If you can't think of, what type of diet, the DASH diet, dietary approach to stop hypertension, focuses on reducing processed foods, red meats, increasing fruits, vegetables, legumes, and things like that. Start to incorporate that into your diet. You will see your blood pressure come down. It's going to come down slowly over time. This is why sometimes if your blood pressure is in the 160s, 170s, medications help to bring that down while you work on those lifestyle changes. But if your blood pressure is in the 140s and above, lifestyle changes, yes, but also medications may be the only way for you to be able to bring it down acutely, because the higher your blood pressure is, the harder the heart has to work, the more propensity of you developing things like a heart attack, heart failure, strokes, dementia. So some people can have high blood pressure due to something else. This is known as secondary hypertension. It can be due to the most common cause that's not being diagnosed enough, sleep apnea. It can be due to a pheo, which is rare, but it can be due to issues with hormones, thyroid. It can be due to menstrual cycle or the lack of menopause, perimenopause. There's a lot of other things that factor into it. It can be due to the kidney, renal artery stenosis. So it's a huge process to treat your blood pressure adequately, both with lifestyle changes, medication, but also ruling out secondary causes. I hope this helps.